Hey, everybody. This episode discusses internalized weight bias, disordered eating, medical weight stigma, and body based shame. Listener discretion is advised, especially for those with lived experience of eating disorders or body image trauma. It may not be appropriate for young listeners. Parents and caregivers may want to listen privately.
My daughter was in the Girl Scouts and we were doing a cookie booth outside of a grocery store. And a lady who had to be in her 70s came up and she's like, "Oh no, I'm not on a diet. I can't once on the lips, moment on the hips," or whatever they say that is. And she wasn't the first woman to do it. And multiple times women would come up and either buy cookies and say, "Oh, I shouldn't be doing this. I have no business eating these cookies." Or, "I don't know why I'm doing this. This is just undoing what I just did." Or, "Oh no, I can't. I'm on a diet," in front of these girls who were 7 and 8 years old. And I was...
It's okay.
I was panic stricken because I was thinking, even if this is going over their heads, that's not right.
That's not
Yeah,
for whatever reason.
because one of the girls was just about to eat a cookie and she stopped.
Ooh.
And she's thinking, "Oh, hey, wait, am I a bad person? Should I not be doing this? Is this not good for me to do?" And we're sucking out the enjoyment in that experience for her. And also, it's very sad to think that that woman lived to be that age and has this relationship with food that is completely unaware. If you asked her, "Do I want other women to feel like their value is based on the way they look?" anyone coming through the 1950s would say, "Absolutely not. That was horrible," right? I imagine, especially in the feminist movement. So I don't think by any means she intentionally did it, or any of the women after that. But it's very hard to determine as a parent, and certainly as a psychologist, how much emphasis do I put on this right now? Do we have a specific conversation about it? Is that too much? But nonetheless, we need to be having those conversations because kids, boys too, are hearing how we talk to ourselves.
Yes. What's unsettling about that interaction isn't the comment. It's how ordinary it is. Moments like this are easy to miss. They're not dramatic. They're familiar. And they live in the way we talk about food, about bodies, about ourselves, in front of kids, and in front of each other. Which brings us to the question we don't ask enough. What happens when these messages turn inward? I'm Dr. Jess Hayden, and you're listening to Simply Heard, The Space Between, where psychology meets the human story. Today's guest, Dr. Jessica Tomasula, is a clinical health psychologist and founder of Live Well Psychology in Raleigh, North Carolina. Clinical health psychology is a fairly new field, so I asked her about her training.
We look at the biological, psychological, and social aspects of someone when we're working with them. Most of us train in medical settings and are particularly trained in one or two disease states so that we can fully understand the link between physical and mental health. And my master's is in pediatric school psychology, which looks at how do chronic health and mental health conditions impact child development and learning.
Dr. Tomasula spent years working in a pediatric weight management clinic, and that's why I invited her here today. I wanted to know a little bit more about what happens when we hear these messages. Ugh, I can't fit into my pants. I have to lose weight. Don't eat that. You're going to get fat. I wish I could look like her. Flat abs. Lose weight today. I'm going to have to go to the gym after this. I ate way too much. You know the messages. They're all around us every day. And there's a name for this process. It's called internalized weight bias. And it sounds clinical, but I think as soon as you hear the definition, it's going to sound quite familiar to you.
Internalized weight bias is essentially what society tells us about looking anything other than like a supermodel or the perceived standard of beauty. If you look anything different than that, then they treat you differently. The messages are different. And internalized weight bias is you believe those things and turn it on yourself. So it's like self stigma.
Okay, so I just want to get this straight. This is very different from externalized weight bias, where we're getting the messages from outside of us, like magazines or advertisements to lose weight fast or look like a certain body shape.
Yeah. Or your grandmother saying, hey, you're looking a little pudgy, right? Yeah. So very, it could be covert or overt, like those subliminal messages that make you seem and think that you are not enough, or you have to have X product, or you have to be in the gym X amount of times in order to feel healthy and to look good. And they could be very overt ways of shaming and discriminating and really tearing you down based on your weight and shape. Yeah. And so all of those experiences, which could be a talk just into itself, yeah. From all of those experiences, we then turn it on ourselves and believe it. And that becomes our inner monologue, that criticism and the stigma that we put on ourselves.
The more we hear these messages from society, the more they live inside us as truth. We start internalizing them and hearing these messages as our own voice. And they don't always show up the way we think.
I think two clear examples are self-deprecating humor, which of course I love and I use myself, but truly you see a lot of comedians who make fun of themselves because of their weight, and also other comedians who feel that it's fine to make fun of someone because of their weight, right? Or body shape. So, and then so that's very acceptable for you to fat shame someone, and then also to use that self-deprecating humor. And then the biggest one I'd say is to become more aware of when your body changes shape or you gain weight. Does your self-worth, your sense of self-worth change? And for a lot of us, our self-worth, our feelings about ourselves change based on our weight and changes in our shape. And that's really hard to stomach and swallow when certainly we as mental health providers don't want people to feel as though they're worthless or less worthy just because they have a different pant size.
Right.
But that's what happens.
Right. Like that if I gain a pound or two, or if I look like I'm muffin topping or something over my jeans, then I won't be chosen, picked, loved. People won't still like me.
It's that I don't believe I'm worthy of any of that.
Right.
Because of my weight and shape.
Right.
So, of course, I would have a boyfriend who's not nice to me because that's all I deserve.
Oh.
Right? So it really is you accepting that, yes, this is true. What people and what society have been telling me, I wholeheartedly believe.
That hits different than what I was thinking about in terms of like, oh, if I gain a few pounds, then I won't be chosen. I won't be liked. Instead of like, then this is all I deserve. I am deserving of this because of.
And less deserving of because of.
Yeah. Okay. Let's take a moment to process. This is some heavy stuff. I judge it to be heavy. The whole time Jessica was talking, I was thinking to myself, oh yeah, this is about being judged, or about the worry about being judged. But you heard my when I got it. This is about the worthiness you feel. I am not deserving of a happy, healthy life because of the way I look. And that hits so different. I think this also makes me feel kind of sad because I can identify with this at different points in my life. thinking that I wasn't worthy or that I wouldn't be chosen because of the way that my body looked, and thinking that that was normal, thinking that it was actually true or real because of the messages that we get from society or from the media or even our own families. Remember the cookie story? Remember the cookie story? One of the reasons this matters so much is that kids don't wait for explicit lessons to learn. They learn from what's modeled, what's repeated, and what's normalized. And I think that this happens way earlier than you think.
When we think about internalized weight bias, it has to come and start from somewhere. And we can think of all the factors outside in our environment that give us these messages that we are not enough based on our weight and shape. But at what age do you think those thoughts start to become the inner monologue?
Like more solidified?
Yeah, like I am not satisfied with the way my body looks.
I was thinking from a developmental standpoint that kids probably start talking about their body shape around 4th, 5th, 6th grade when the onset of puberty happens. And maybe I wasn't shocked, but more so dismayed.
Sadly, it's at least age 6.
Oh my gosh.
So that's kindergarten, right? That people, so boys and girls, are already dissatisfied with the way they look. And we can already see overt discrimination based on body size. So kids are more likely to play with other children, regardless of whether they have a physical handicap, any other condition you want to put there. If you live in a larger body, you're less likely to be chosen to play with.
Oh, right? That's so sad.
And teachers are more likely to call students in bigger bodies lazy, unmotivated, dumb. All of these. I know it makes me sad.
It does make me really sad.
Yeah.
I know. You know, I didn't think that I would have this kind of depressed mood talking about this.
And I teared up just because it's hard for the generation. You know, when we think about this generationally, we want this to get better. But you and I are at the age where we can really influence the generations in front of us. And we have to recognize just how important those conversations and opportunities are.
Yeah.
But we first have to be aware that it exists.
Yeah.
Right?
Yeah. And this isn't just, you know, I think about this isn't just impact girls and women.
No, definitely not.
Because there's also, you know, like, what's the definition of being like, I don't know, like a man, and what does that look like? But but in the same regard, boys are hearing women and girls talk about weight and how important it is. And so then there also might be this idea for boys that, oh, that's the ideal shape of a body for me to be with.
So that's what I should look for.
Yeah.
Or I should expect women to think this of themselves.
Exactly.
That's normal. Yes. We are completely missing, meaning understudying, under-evaluating boys and men. And it is becoming increasingly known that they struggle with eating disorders. They struggle with body image issues just like girls and women do. They're less vocal. You know, we know they're underreporters. Right. We know that from all lines of research. But certainly when you think about certain sports like wrestling and swimming, gymnastics, you could think about all the sports that, weight is definitely measured.
Ballet.
Yeah, dance for sure. So sometimes we see it come out of athletics that they're not able to perform, or that they've changed weight in significant ways, and it will come out that way. But be bigger, be faster, be stronger. And oddly, that's when body positivity, that whole movement comes in, that we should be speaking to ourselves in very kind ways. I love Kristen Neff's work on self-compassion. We could talk all about that. But Lizzo and Meghan Trainor are two singers who originally came out and were full force body positivity. And they've had a lot of songs that are super catchy, and I love them. And as they've gone through their health journeys, and are now in smaller bodies, have come out and said, actually, body positivity is not realistic for me.
Oh.
It's more body neutrality. And that's what, when I'm working with people who have binge eating disorder or just an unhelpful relationship with food or body image concerns, or they come to me for a health condition that they need help managing, that's what I talk to them about. Let's not be disingenuous cheerleaders. Your brain
Right.
is smarter than that, but let's at least be realistic
Yeah.
about the messages that we give to ourselves.
Yeah, because in some ways it's so invalidating to other people when they were like, "Oh yeah, you were cheering me on. You were doing this thing. Like I believed in you and like was like, yes, hell yeah, like we've got like a bigger body and go us." And then it was like, well, actually, we're gonna lose all of the weight and change how we look for whatever reason. It feels a little invalidating to me that they did that.
Yeah, I mean, it can make it seem like, oh, hey, wait, so you weren't happy with who you were in a larger body? And I think that's real. I think that we know when we're doing too much and saying too much, and we're not truly going to believe it.
Yeah.
And I think I appreciate that they had the transparency to come out and say that, to be like, actually, that approach didn't work for me. And so I'm going to clarify that and say, I take a more body neutral approach. And it's much more sustainable.
Yeah.
Because the reality is we're not going to feel good in what we wear every single day.
Right.
And that doesn't take away from who we are as individuals and what we give to this world
Right.
and what we deserve,
Yeah.
you know?
What is body neutrality? What does that mean?
If we think about neutral, so not positive or negative, it's not really one or the other. To me, it's holding space for both. So you can have a tough day with your acne, but still think your butt looks good.
Got it.
You're giving yourself permission to say, okay, I don't like the way my face looks today. And I know that I have really pretty eyes.
This is so interesting because it is very DBT-ish. This idea that two opposite things can be true at the same time, that there are a lot of other possibilities that can be true as well. I also like to think about this as in my body just is. It doesn't have to be good or bad, right? It just is.
Oh, it's that too. You're right. Yeah.
Yeah. Like it just is. And it doesn't have anything to do with who I am as a person.
Right. And that's where the body image work comes in, because a lot of people are very critical about the way they look. And we try to change the perspective to say, what does your body do for you? So that we can start really looking at our body through a different lens. And I know my body has been able to get me to where I am today, right? Without it, I wouldn't be here, right? You know, so I have been able to care for myself in a way that allows me to do things that I enjoy. So switching it from a vanity perspective to more of a functional perspective is very helpful. And people that have disordered eating patterns or body image issues do a lot of body checking. So every mirror they're in multiple times a day, or anyone that they pass, they're fixated.
Yeah.
And of course we all want to make sure we don't have spinach in our teeth. It's not uncommon for people to be concerned about the way they present themselves.
Yeah.
That's not a bad thing, but that we are obsessive about it, and that we don't allow time and space for other things to be in that monologue, right?
Okay, so speaking of mirrors, when I was bodybuilding, I used to look at myself constantly in the mirror. And I actually can look back on this now and say that I do believe that bodybuilding is built on disordered eating and possibly not possibly. A great number of folks who are in the bodybuilding industry also have body image disorders. But one metric stood out to me that is used widely across the medical field for a measure of how healthy you are, and that is the BMI, the body mass index. And we get this metric by taking someone's weight and dividing it by their height. And this is a problem because muscle weighs more than fat does. So you could be super muscular and super lean and also have a high BMI. And it doesn't take into account your bone mass, how heavy your bones weigh. It also ignores a crucial factor like body fat distribution because there is a belief that belly fat is riskier, along with other factors like sex, race, ethnicity, etc. And I'm not saying that BMI is useless. What I'm saying is that if we just take that one metric, it is not an accurate measure of someone's health. Before we started recording, you were telling me kind of a story about how you gave this professional talk about internalized weight bias to some physicians and how, like, the medical model, even with the BMI, we didn't talk about that, but even with the BMI, right? How impractical and how really it doesn't make sense. Like the BMI is not an accurate measure of someone's health and wellness. When I was bodybuilding, my BMI was very high, but my body fat percentage was very low.
Right. I treat people who have binge eating disorder amongst many conditions. Most people who have binge eating disorders live in typically sized bodies. You would not know that they have an eating disorder. And therefore, their physician, when they go in for a checkup or allied medical provider, is not asking them questions related to what they eat or their health patterns because they don't think it's necessary based on their BMI. When truly, they're really in a full-blown eating disorder.
Yeah.
And that's why internalized weight bias is so closely related to disordered eating patterns. Because we then change that feeling of shame and stigma changes what we eat, why we eat, how much we eat. But it's often overlooked or not studied because we're not even aware that this is a common pattern.
Right.
That inner monologue is really impacting our ability to feel good, to make good choices, and to manage our bodies in a healthy way. So people who have emotional eating or binge eating issues, regardless of their body size, if you ask them how do they feel about who they are as a person when they are in a pant size up versus a pant size down, you'll notice, oh yeah, they have a lot of internalized weight bias. And that is very closely connected to their relationship with food. So it doesn't matter what you look like on the outside. This is very much an internalized or mental thing. And it impacts all races, all ethnicities, all genders. No one gets out of it. And we know what people use to help manage their emotions: drugs, sex, alcohol, and of course food. But a lot of those things you can abstain from and lead a fairly typical life. We can't abstain from food. And that's why it's one of the hardest relationships to navigate.
I don't know why I never thought of it this way, but it makes so much sense. Out of all of Maslow's needs, the only one thing that we can really get addicted to is food. We need food to live. And I guess one could make the argument about love addiction. And yes, that's a thing. We'll talk about it in another pod. Anyway, it makes sense that so many people would have such a complex relationship with food. Not only do we need food to live, it's also pretty central to a lot of our social interactions. We go out to lunch, we meet people for dinner, and then there's the cultural and religious traditions that all center around food. And we also know that food is linked to our dopamine reward system in our brains. So eating food actually makes us feel good. Okay, I want to return back to the part where we were talking about the medical field, because that's where we're going next. Research shows that the earliest experiences of weight shaming happen in people's families, then school, and next in a doctor's office. And I want to be clear, this is not meant to blame or shame medical providers. And we do have to acknowledge that it exists. Therapists, psychiatrists, and other helping professions, we're not off the hook either.
They have a lot of influence. And when I worked in a specialty clinic for over 7 years, working with families who were trying to manage their health as a family to either reduce or erase conditions that they've acquired as little kids or adolescents, they would come into clinic completely beaten down and worried that we were going to make them feel ashamed for who they were and what bodies they lived in, because they had had multiple experiences over years of sitting in front of medical professionals, for instance, for an ear infection, and being told you need to lose weight.
Whoa.
It's jarring. You're coming there for a completely unrelated condition, and somehow you're walking out feeling much worse. And they're getting better. I think there are a ton of pediatricians who really look at the growth curve and say, okay, we don't want to see any jumping off, right? We don't want to see any significant changes upwards or downwards. And that, kids grow at different rates and paces, and we'll just make sure we keep an eye on blood work and things like that. That's perfect, because then we're not taking a look at BMI, which isn't, as we said, an accurate. Right. Yeah, we don't want to use that metric. I think all of us, even in helping professions, because we've grown up in this society that really values weight and shape over a lot of other things, intelligence, right? The list could go on, that beauty is very important in our society. We have to think about our own implicit bias in that. And so the more we can consider these things, like, do you make an audible noise when you notice someone sitting next to you on a flight or in a waiting room is in a larger body, whether they're taking up some of your space or not? Some people will, even if you don't do that, are you annoyed? Are you orienting yourself differently toward that person than you would if they were in a smaller body?
That's such a good question. I bet a lot of us do that without even knowing.
Right. And I think about anyone who is in a business. Do you make sure that your spaces are available for people who live in larger bodies? Are they, is it walkable, right? We think about strollers, we think about elderly people.
Wheelchairs.
Yeah. So I think about that. That's something that for us to test ourselves. And then I also think, and this is really awkward to think about, but what messages have we received ourselves as we were growing up and even now as adults that would reinforce the notion that if you're in a larger body, you are not a good person, right? And so those are comments.
Yeah. If you're listening to this and feeling a knot in your stomach, maybe thinking about ways you've reacted, assumptions you've made, or comments you've laughed at, I want you to know you're not alone. I, too, have been sitting in that discomfort. Because guilt often shows up in conversations like this. And it makes sense. Guilt is what happens when we do things that go against our values. Where we don't want this to go is a place of shame. Shame says, I am bad. So if this conversation is stirring up shame or defensiveness, I want to invite a different response. Instead of asking, am I a good person? Try asking this. What am I noticing right now? And what do I want to do differently going forward? That's the work.
One of the things, though, as we talked about, this is fairly depressing topic, one of the things that I know to be true, that what we can do to work against it is to promote the acceptance of all body types. And how do we do that? You can see like Dove and, like there's lots of campaigns that even allow that into other spaces, and fashion designers and things like that. Like we're getting better at it, and that's part of body acceptance. But I think also calling out what are unrealistic and unhealthy beauty standards. So when I work with adolescents, I'm always talking about being a social media detective. Are they using a filter? Why are they presenting this information in this way? Right? What do you notice about these accounts? How do they all look similar? Oh, they're all wearing the same clothes, or they're all wearing the same brand, or they all have their hair the same way, right? So that we can call out, how are you receiving these messages? And just to be curious and remember that social media is curated. It's not real life. Because they're looking at those images a whole lot more than they're paying attention to what adults and parents say.
I love how Dr. Tomasula teaches kids to be good consumers of social media. I think we could all use that advice. Okay, so I promised you all that I would try to keep it under 30, and it's a little bit over. And we're going to hear more from Dr. Tomasula in part 2. I'm hoping to crank that out before Christmas. Okay, and one more thing. I am super excited because I have started to do these interviews in video. I can't wait to share the clips with you. If you'd like to work with Dr. Tomasula, you can find her at Live Well Psychology in Raleigh, North Carolina. If you'd like to work with me, Dr. Jess Hayden, you can find me at Simply Centered Psychological Services, also in Raleigh, North Carolina. While I do not specialize in eating disorders, I do specialize in dialectical behavior therapy. If this episode stirred something up for you, you're not alone, and you don't have to be alone. There are places you can turn. A therapist who specializes in eating disorders or body image, a weight-inclusive dietitian, or organizations like the National Alliance for Eating Disorders and NEDA can be good starting points. You don't need to wait until things feel bad enough to reach out. Support is allowed at any stage. I'm Dr. Jess Hayden, and this is Simply Heard, The Space Between, a podcast produced by Simply Centered Psychological Services in Raleigh, North Carolina. Until next time, take care and be easy on yourself. Simply Heard, The Space Between is for educational and informational purposes only and should not be used as a replacement for therapy. If you or a loved one is in crisis and in need of mental health services, dial 988, the National Mental Health Crisis Hotline.